I'm going to spend a little time now talking about how we think about an approach to mental health care and treatment at Natural Mental Health, a little bit differently than I think what a lot of you are familiar with. I want to start with a quote that I just love from an author that many of you might recognize. Margaret Mitchell wrote Gone with the Wind, and her quote is, "Every problem has two handles. You can grab it by the handle of fear or the handle of hope." And we are choosing intentionally to grab this problem by the handle of hope. I do want to spend a little time talking a little more about the problem, facing it, addressing it, because it is big. I'm actually not a child psychiatrist, so I don't work with kids or teens myself. Older teens, college students, yes, but I don't have that direct experience working with kids. But this is devoted to kids and teens, and as you all know, they are under a lot of stress these days, as we all are. But it's not new. It didn't start just with COVID, and this trend towards greater mental health challenges did not begin in 2020. There is a really interesting long-term epidemiological study that goes back to the year 1910. So with the US Census, every 10 years there's a new data point wherein a number of people in the US are asked questions about their mental well-being. Really, it's another way of thinking about resilience, that our resilience is eroding over time for perhaps all kinds of reasons. So what we've seen every decade, every time that this has been measured, is that rates of anxiety and depression in the US have increased about another 10%. Over 100 years' time now, that is a lot of increase. It's not only the 10%, it compounds over time. So it's a little bit more like an exponential graph, if you know what I mean. In children and teens alone, since just 2009, so just the last decade, rates of depression have increased by 60%. That's a really big increase in a short period of time. Rates of suicide, again, this is pre-pandemic data. Rates of suicide increased over a period of 5 years by 24%. Emergency room visits due to suicidal behavior or feelings doubled in kids and teens since 2007. So again, this is not new. This is a growing problem, but it has been accentuated in the last year. Thinking about the broader population for a minute, a lot of people don't know this, but depression and anxiety are the #1 causes of disability in this country. So it has been true for a long time. And this is of all health problems, not just mental health, but of all health problems. The rest of the world, that has not been so true, but they're catching up very quickly. Even in developing countries, rates of depression and anxiety are increasing fast, so that the World Health Organization predicts that just in 10 years or less, depression will be the #1 cause of disability around the world. You really can think of this as an epidemic. There's an annual college survey that's actually done by the University of Minnesota, but it's colleges around the country, looking at mental health and well-being among college students. And what they're finding just a few years ago is, again, an alarming trend toward increase. Fully 1/3 of college students report sometime in their lives having had some kind of mental health diagnosis. Mostly that's anxiety, but a really high rate of depression too. And I've spent most of my career actually working some of my time in college mental health centers. And so I've had 25 years now of firsthand experience. And I can tell you that rates of more serious mental health problems have just been going through the roof in that age group. A lot of it is caused by stress, and stress is something we're going to be talking quite a bit about. But remember that stress does not only refer to what's happening outside of yourself in the world around you, or or external things. It is also how we perceive it, how we relate to it, to what's happening. And that's really, really important. So how are we doing at treating this? I'm just going to go through this kind of quickly, but in Minnesota, there's an effort to see just how well we're doing at treating certain important public health conditions. And one of them is depression. Today's workshop is really more about anxiety, but they're very closely linked, as I'm sure you know. So looking at depression treatment, which is done mostly in primary care settings, by the way. Most antidepressants are prescribed by family physicians and pediatricians. So in the state, there are 115 clinics participating in this study. Out of that 115 clinics, only one of them has a rate of remission of 29%. That's the highest of all of them. The average is somewhere closer to 10%, and a good outcome is considered something over 20%. Now, if you're not in mental health care or health care generally, you might not realize how poor those numbers are. But when I did my training, we learned that if you didn't even treat depression, you just let it run its course, offered no help whatsoever, that within 6 months to a year, approximately 50% of people would have recovered. And what we're seeing here is that at 6 months, the numbers are far less. Now, why is that? I can't really explain that. The usual treatment, though, I can tell you that, is medication. It's actually a smaller percentage of people who are offered therapy. Medication is the kind of the frontline treatment for most people. Maybe that's more true for adults than for kids, but there's also a lot of kids who are on medications. That's not necessarily a bad thing, by the way. We are not opposed to medication use. It's just that it's not working very well, and I think we can do better than that. So these are complex conditions. They do not lend themselves well to a single intervention like medication or even like certain forms of therapy. We have to recognize that we human beings are complex, and the way that we relate to the world is increasingly complex, and we need to find things that kind of match that complexity. Also, patients and parents, we think, are looking for more things that they can do for themselves, or they can help their kid or their teen learn to do for themselves, so that they don't have to rely on an expert or a medication or even the natural therapies we're going to be talking about, that they have the resources within them that they can use to face whatever it is that they're needing to face. So one of our catchphrases that we like to remember with natural mental health is we want to focus on more skills and less pills. I want to spend a little bit of time talking then about how we envision recovery from conditions like anxiety. And I want to talk about it in 3 stages. So the first stage is to restore your function back to your baseline. So if a person has become significantly depressed or anxious such that it is affecting their function, their ability to perform as a student, as a friend, as a family member, their function is impaired, then we want to get them back to their baseline. And I'll tell you that this is really the primary purview of healthcare. It's not to get people functioning better than before. It's to get people functioning back to where they were before. And that's a worthy goal. It's an important and worthy goal. I would argue that it's not enough, because when they were at their baseline, they developed a severe anxiety problem or a severe depression or something along those lines. So we need to be thinking a little different, but it is still really important to be able to get people back to their original baseline functioning. And one way of thinking about this is that we're trying to restore their vitality and get them at a place where they can begin crafting some greater skills that help prevent this from coming back again. So that is, I guess we'd call it Act 2, which is to sustain the improvements that have been achieved through some form of treatment, and to do it over the long term, not just for days or weeks or even months, but over the course of a lifetime. I mentioned that I do a lot of work in college mental health settings, and one of the reasons I've stayed with that for so many years is that I really believe that if we can catch something early at that stage in a person's life, we can help them make very minor adjustments, just a little change in their lifestyle or their ways of thinking about themselves or their ability to withstand difficult emotions. Just a little tweak, if you will. And their outcome years down the road could be very, very different. So, this idea of sustaining and preventing recurrence, it gets harder as we get older, quite frankly. But when we're young, and especially working with kids and teens who are struggling, it might not take massive wholesale changes to make a huge difference in the course of their lives. And then the third stage, which is not something that most of us in mental health are really focused upon, and that is to try to help the person not only recover, not only sustain their improvements and be resilient, but to flourish in their lives. And if you're a parent, this is absolutely what you want for your kids. You want them to flourish. You want them to be fully alive, to be doing what they love to do, to have really good friends and relationships, to be really engaged with their families. So I want to invite us to think about what does it take to get people to such a level of thriving in their lives that there is just less room for something like anxiety or depression to find its way in. This is a graphic way of thinking about this that kind of gives you an example of how my mind works. So thinking about body, mind, and heart, and then these three levels of recovery and improvement. And you can read through this. There's probably more details than you want, but it's a model that I think is it makes sense, and it's kind of complex. It reflects the complexity of our human condition. But Tim offered up this other option that he said it's just not that complicated, really. And this is I think, cartoon from the New Yorker that says the top 10 stress management techniques are to eat, sleep, eat, sleep, eat, sleep. And actually, those two things done right can go a very long ways toward keeping us healthy and resilient. The way we think of this integrative approach to mental health, what we call natural mental health, is that we're not throwing out the other ways of doing things. We're not saying medication is bad, everybody should avoid it. We are trying to add to the conventional toolkit with other things that we think are really helpful and can be portable, that they stay with the person over a long period of time. So we're not replacing, we're expanding. This is just to give you a little bit of an idea of how the conventional mental health toolkit might look different and be complemented by this integrative one. So the conventional toolkit is largely focused on prescription medications, psychotherapy, which is obviously very important and can be really helpful. Sometimes people have access to family therapy, which can also be incredibly helpful. Schools are taking on increasing roles of trying to help kids, with IEP and 504 plans and specialty schools devoted to kids who have particular challenges. And then there are rehabilitation therapies that help with kids who are challenged in a particular way. The integrative mental health toolkit really looks more deeply into lifestyle medicine, diet, exercise, supplement, healing the gut, which again makes a very big difference in mental health. There's a big focus on exercise and sleep, ecotherapy, such as being out in nature and really letting nature do its healing thing for you. Focusing on mind-body therapies, things like mindfulness skills, using arts, expressive art, to deal with difficult emotions. There's biomechanical therapies. There's functional medicine. There's apps that people can use, and a number of different devices. So using technology to help the brain heal. If none of this works, if all else fails, you could do something like this, where I tried to help my colleague Tim through good old-fashioned couch-based psychodynamic psychotherapy. So thank you for listening, and enjoy the rest of the day. And remember, you'll have to take your break on your own, because we're not going to have a formal break.